board of Gove County Trustees is in session right now. And after this, I'm going to give you a short little speech, I guess. Good afternoon, and thank you all for coming. I'd like to introduce myself for those who do not know me. I'm David Gove, the chairperson of the Gove County Medical Center Board of Trustees. I'd like to introduce the rest of the Board of Trustees for those who may not know. Terry Osmeyer, Vice Chair, Deb Ayton, Secretary, Cheryl Remington, Treasurer, and Greg Booker, Member. As many of you know, several or most of the board members have spent most of, if not all, their lives in Gove County. The decision was extremely hard and almost impossible. The board's thought in the beginning were not only no, but heck no. After a full discussion with the CEO to explore any option that may enable the community to keep the long-term care, Connor was asked to do so. After 6 months or more, it was clear that the decision had to be for the longevity of this community. Please understand that every available option was explored until there were no more left. The board, with very heavy hearts, made the decision to close the long-term care. I would now like to go over the expectations for today. I would like to ask each and every one of you to put yourself in the board's place after you hear the presentation. Please ask yourself what your decision would be. You are asked at the entrance to sign up if you had a question you would like to ask. Questions will be addressed and answered after the conclusion of the presentation from both Chad Austin, the Kansas Hospital Association Chief Executive Officer, and Connor Fisciarelli, the Gove County Medical Center Chief Executive Officer. Once your name is called, you will be given up to 5 minutes to ask your question and have it answered. This is in the interest of having what we expect, a multitude of questions. I am hoping that some of the questions will be answered by the presentation. If so, please let me know when I call your name during the question and answer section. When your name is called, please state who your question is for and state your question. State and federal legislators were invited to come to this forum. Some could attend and some couldn't attend. And we have Henry, from Tracy, sorry. So we have heard, and we're going to hopefully have more this evening, I'm pretty sure of it. Now I'm going to go to the format for today. The first presenter will be Chad Austin with the Kansas Hospital Association, followed by Connor, the CEO. After Chad's presentation, he will ask for questions for 10 to 15 minutes, but they pertain to his presentation. And we'll answer anything with the long-term care after Connor's presentation. I want to attest that his presentation is factual, verified, and transparent. The financials that are being presented are audited. With that being said, take it away, Chad.
Hello, can you hear me okay? Is it on? All right. Well, thank you very much for the opportunity to be here to provide some information related to Kansas hospitals, as well as some of the activities that we're seeing, not only nationally, but also within the state of Kansas. Just to be able to level set, as was introduced, I'm Chad Austin with the Kansas Hospital Association. I've been with the Kansas Hospital Association since 1999, so I've been here for a few years. Very familiar with our hospitals from across the state of Kansas. In addition, I've been the president and CEO of the Kansas Hospital Association since 2020, so I've had a few years in that capacity as well. What I wanted to do is, first of all, thank all of you for coming out today to be able to talk about what's happening locally in your community with healthcare. Healthcare is such an important part of not only our state, but our local communities, whether we're talking about hospitals, long-term care, clinics, or whatever the case may be. And so what I wanted to do today is to share with you a little bit of what we're experiencing from a statewide perspective for the Kansas Hospital Association and our hospitals across the state. Just to be able to share with you, we have 123 hospitals across the state of Kansas, of which 82 are critical access hospitals, just like your facility in Winter. And outside of that, we have about 45 hospitals that are called what we say prospective payment system hospitals. So those are going to be hospitals like Hayes, Salina, the hospitals that are located in Wichita, Kansas City, Topeka, etc. And so as we look at what's been happening as it pertains to healthcare, the last few years have been very challenging from a hospital perspective and a healthcare perspective. And quite candidly, you can put it into 5 different buckets in terms of what's challenging our rural hospitals across the state. First and foremost, looking at workforce shortages, and I'll delve a little bit deeper into that here in a few minutes. In addition, focusing on stagnant reimbursement that we're receiving. Right now, when you look at reimbursement and the different payers for healthcare services, you have public payers and you have private payers. So public payers are going to be programs like the Medicare program, the Medicaid program. The private payers are going to be commercial insurance, such as Blue Cross and Blue Shield of Kansas. And then you also have the uninsured, which is, in essence, self-pay individuals. When we look at communities across the state of Kansas, and specifically in rural communities, the largest percentage of the payer category is going to be the Medicare payers. And so in essence, when you're looking at that, quite candidly, when you add in Medicare, Medicaid, and self-pay, that's probably in many regards about 70 to 80% of what the payer mix is for a rural hospital. When you look at how hospitals are reimbursed under the Medicare program, the Medicaid program, and self-pay, it may be understood or it may not be understood, but like with self-pay, oftentimes you're writing that off for charity care or uncompensated care. With Medicaid, you only get a fraction of the dollars that are being paid for our hospitals. And then with the Medicare program, in essence, you get maybe about 80 to 90% of what the cost of care is. So already, in many cases, the reimbursement from self-pay, Medicaid, and Medicare is below what they cost to be able to provide care in that local community. Outside of that, what you typically see is that you have commercial insurance, where oftentimes hospitals or other healthcare providers try to balance their books related to getting more revenue coming in to help offset the losses under the public program and the self-insured program. In other cases, what we have is we have about 50 county hospitals across the state of Kansas, and oftentimes the county comes in and they provide some type of local tax support as well. And so we do see that in many cases across the state of Kansas. In addition, as many of you may expect, and this isn't just relegated to healthcare, inflation as well as supply cost has gone up dramatically. And when you put that into context, when reimbursement has not changed or doesn't change very regularly, that puts more stress, financial stress on a hospital and the healthcare system. Other challenges that we see in some of our rural communities is demographic changes. We're become an older population in our rural areas, which adds additional stress within our local communities. And then there's a number of regulatory barriers that we have across the state of Kansas, as well as on the federal level. When we look at healthcare financing, a couple things to kind of keep in mind. It is a very interesting and challenging circumstance when, in essence, you have some of your largest payers, again, the Medicare program, the Medicaid program, and when you have self-pay, when in essence you don't cover the cost of care. And so there's not very many other industries that can really be sustainable to be able to have that type of reimbursement policies or environment to be able to be viable in the long run. In addition, we see that healthcare, and specifically hospitals, we're highly regulated by the government. We have a lot of capital investments that we have to do with our facilities and our equipment. And then also we see that we have much, especially in Kansas, low and negative operating margins. There's been a few studies that have been conducted nationally where they look at operating margins for hospitals, more specifically rural hospitals across the country. And as you can see with this map here, Kansas, in essence, has about 79% of our rural hospitals are operating with a negative margin, which is one of the largest states in terms of having the most hospitals at a negative margin. Which then equates to that we have a number of hospitals that are at vulnerability for providing the services or just being able to provide longevity for their hospitals within their community. From a national perspective, there's about 43% of rural hospitals are operating at a financial loss. When you break that down to the state of Kansas, we have 79% of our rural hospitals are operating at a financial loss. And the medium operating margin for a rural hospital in Kansas is negative 6.8%. So what are some of the impacts, why we're kind of facing some of these challenges? And so this chart here basically shows some information related to that. First and foremost, 95% of our healthcare facilities report hiring temporary staff. Over the course of the last couple of years related to the pandemic, we've been stretched and strained in terms of being able to provide services within our communities, with our hospitals, where we've been contracting with contract nurses and other healthcare providers and healthcare professionals. That additional cost, where we've seen agency staff, has doubled in many cases over the last couple of years. In addition, average annual hourly wages have increased by 8.5%. Labor cost is now over 50% of a hospital's total expense. I mentioned supply cost is also up across the board, where we see supply costs have increased by 20%. And so when you take that into consideration, expenses are going up from a labor perspective, expenses are going up from a supply perspective, and the reimbursement that we're getting with our largest payers are remaining fairly stagnant, and we're not seeing the changes to keep up with what we're seeing with the additional expenses. So just to be able to share some other information, because this is something from the Hospital Association we really delve deep into, we track on a regular basis in terms of what's the trend not only in Kansas, but what's the trend nationally. And over the last 13 years, we've seen 140 rural hospitals that have closed nationally. 600 of them are now considered vulnerable of the hospitals that are remaining in rural communities. We have roughly about 56 hospitals in Kansas based upon this study that was conducted nationally that are listed as vulnerable hospitals within our rural communities. And since 2010, we've had 7 hospitals that have closed. As I mentioned, workforce is a big component as to what we're focusing on in terms of how do we ensure that we have the staff to be able to provide the care that's needed in our healthcare settings. And so as we look at primary care shortages and mental health shortages, there's a lot of shortages that we're seeing across the state of Kansas from providing healthcare in our rural communities. So why do we have some of the shortages as it pertains to the workforce aspect? Well, the last couple of years has been very challenging, I think, not only on all of you, but also on our healthcare providers as we've gone through the COVID-19 pandemic. That has really strained many of our healthcare providers across the state, not only in rural areas, but also in urban areas. We're seeing more people retiring, and so when you have more people retiring, we have not been able to keep up with having individuals coming into our healthcare professions to be able to replenish the work that's needed to be there. We're seeing more flexibility or people desiring flexibility, and so they're looking for positions outside of healthcare. We've had some salary and benefit limitations, as I mentioned, largely for a hospital and a nursing home and other types of healthcare providers. Your reimbursement is fairly stagnant. There's not the ability to see significant increases from a reimbursement perspective of the Medicaid program, the Medicare program, or even commercial insurance. And we're also seeing healthcare workers moving out of the acute care setting and going into more stable and standard positions outside of acute care settings. So they could be going into more clinics or other types of non-hospital related settings. So in general, we've done some analysis with our hospitals, and about 95% of the hospitals rely on healthcare staffing agencies to fill vacant positions. And again, this is at a premium for us to be able to do that. And so as that has compounded over the last couple of years, that has really put a lot of strain on our hospitals and on the healthcare system in general. The impact on the staffing does have also an impact on the services that we're able to provide. In addition, the quality of care that we're able to provide. So that's something that we're trying to lean into as a state as well. One item I would just kind of mention, and this isn't specifically talk about Medicaid expansion, but that is something that as we're looking as an association perspective, we're doing whatever we can to find additional revenue to come into our hospitals, whether it's working with the state of Kansas and our legislators to talk about Medicaid reimbursement, whether it's advocating on the federal level to look at programs to be able to help support hospitals as well as long-term care and other providers, or whether it's looking at regulatory relief that we're able to provide for some of our hospitals from across the state as well. But as we're looking at that, one of the challenges that we're going to be continuing to see is that as these expenses continue to outpace the ability to see increase in reimbursement or what have you, it's going to put more strain on local communities to make decisions, and which are very tough decisions, which are, what do we do in terms of the choices that are out there? Do we look at making changes locally with any type of local tax support? Do we look at making changes to the types of services that are provided? And so lots of difficult conversations that I know your board here in your community has been having are also the same conversations that are happening in many, many other communities across the state of Kansas. And that is something that as an association we're working with our hospitals to see what can we do to help support them, to be able to provide some choices, to be able to provide some financial relief as we're looking at that. And so just wanted to share with you on closing as this is conversations that are happening unfortunately in communities across the state of Kansas as well as across the Midwest as we're looking at that. With that, that gives you a little bit of an overview. There could be some questions, but I'm happy to answer any questions that people may have related to what we're seeing statewide, what we're seeing nationally, or give the time back to Connor and his team to be able to kind of talk more specifically about what's happening locally.
Do you have any questions for Chad on his presentation? You want to come up to the mic, please?